Before that, I would like to give you a hint. At first, this is the diaphragm. This is the diaphragm. Diaphragm has three apertures, and this is we use a mnemonics. This is a voice of America. V for inferior vena cava, O for esophagus, and A for aorta. This is thoracic 8 level, this is thoracic 10 level, and this is thoracic 12 level. Every single thing is important here. And just above the diaphragm, the left side mostly, this is a structure that is called heart. Okay, this is the heart. And if it is a midline, just think it is the midline. Aorta just comes from the left ventricle and is the ascending aorta, arch aorta, and it comes here like this. So this is thoracic aorta, like this, and the aorta. And inferior vena cava, like is the midline, like this, the vertebral body, and inferior vena cava goes downwards to upwards. Sorry, I'm changing the color. Downwards the upwards, and it goes here and goes into the right atrium. So, on which vertebral level abdominal aorta comes in the abdomen? Tell me, which vertebral level? This is thoracic 12.
12.
Is it clear? Everyone, please
Yes.
talk with me.
Yes, Bhaiya.
And
Yes,
this is the inferior vena cava, and inferior vena cava comes in the thorax through piercing the thoracic 8 level, because diaphragm is a curved level, and we are just have a look at two-dimensional structure. So always remember, if it is the midline, aorta will always remain in the left side of the midline, and if it is the midline, vena cava will always remain in the right side of the midline. Is it clear, everyone? Everyone, please
Yes.
tell me. It's very
Yes,
important.
Bhaiya.
So don't forget this one. I have seen so many of surgeons, so many of junior resident or FCS training. They used to do this mistake in a very regular basis. So abdominal aorta remains on the left side and vena cava remains in the right side. So abdominal aorta enters into the abdomen of the thoracic 12 level, at it divides in the level of lumbar 4 level. The lumbar 4 level. So always remember, it forms in the thoracic 12 level and divides into the lumbar 4 level. And by forming which vessel? This is called external iliac. Sorry, common iliac. Sorry, it is called common iliac artery. And common iliac artery ultimately divides into two parts. One is internal iliac artery and another one is external iliac artery. Okay. And while external iliac passes through the inguinal ligament, this part is known as femoral artery. That means femoral artery is nothing but the continuation of the external iliac. Are you getting me, guys? Everyone?
Yes, Bhaiya.
Yes. That means femoral artery is nothing but the continuation of the external iliac artery. When it passes underneath the inguinal ligament, its name is changed into the femoral artery. And this external artery, external femoral artery supplies the, or external artery, continuation of the external artery supplies the lower limb. And the continuation of the internal iliac artery has two main branches. One is anterior division and another one is posterior division. And both of division mostly supplies the pelvic organs. Pelvic organs. That means lower part of the rectum, that means prostate, that means uterus, that means urinary bladder. All of the structures are supplied by the internal iliac artery. Are you getting me, guys? Internal iliac artery, right? Okay, come to the anterior abdominal wall and abdomen again. So this is the diaphragm, this is the abdomen, abdominal aorta, and this is the lumbar 4 level. It divides into the common iliac artery. Now, it pierces the diaphragm of the thoracic 12 level just assume thoracic 12 is this vertebra and it's a larger one, body is larger. Whenever it comes into the abdomen, immediately it gives a branch that is called celiac trunk, and this is the anterior
Celiac
branch. Yes, so this is the first one. There are three anterior branch from the anterior abdominal wall. So at the level of thoracic 12, this is the celiac trunk. Then at the level of lumbar, after that, at the lumbar 1, that is the superior mesenteric artery, and at the level of lumbar 3, that is the inferior mesenteric artery. So if you are asked, what are the anterior division or anterior branches of the anterior abdominal wall? Tell me, guys, what are the anterior branches? Ventral branches. One is
Celiac trunk,
celiac trunk, anterior superior
superior
mesenteric artery,
mesenteric
and inferior mesenteric artery. And superior mesenteric artery is at the level of lumbar 1, and inferior mesenteric artery is the lumbar 3.
Number 3.
Okay. Okay. Just ectoderm, primitive ectoderm starts from our alimentary tract, starts from the lower part of the esophagus, like this is the lower part of the esophagus. And after that, we'll have the stomach, duodenum, second part of duodenum, jejunum, ileum, descending jejunum, ileum. Then we'll get the cecum, ascending colon, then the transverse colon, and changing the color, transverse colon. Transverse colon has two parts, left 1/3 and right 1/3, right 2/3 and left 1/3. Then the descending colon and sigmoid colon. Then the anal canal, upper part, upper 2/3. Okay. Remember, from the lower part of the esophagus up to second part of duodenum, this is called foregut. Foregut. Up to this portion, from the second part of duodenum, lower part of the second part of the duodenum, up to the right 2/3 and left 1/3 is called midgut.
Midgut.
Midgut. And left 1/3 of the transverse colon, descending colon, sigmoid colon, and this called hindgut. Hindgut. Okay. First part, this foregut is supplied by the celiac trunk. Are you getting me, guys? Are you getting me?
Yes.
Yes, ma'am.
And midgut supplied by the superior mesenteric artery, and the hindgut supplied by the inferior mesenteric artery. Are you clear?
Mm.
Okay. So if you are asked, a surgeon just resected a or surgeon have done a Hartmann procedure, and while doing the Hartmann procedure, he ligated a left colic artery. And left colic artery originates from which of the following vessel? Which vessel left colic artery? Okay, I'm
inferior mesenteric artery.
yes. Okay.
Mesenteric.
Okay, just have a look. A surgeon resected a or have done a Hartmann procedure, or patient presented with diverticulitis, and you have resected diverticular portion or affected part of the gut, and this part get the blood supply from which and the blood vessel originates from which of the following vertebral level. So diverticulitis is your sigmoid colon, and sigmoid colon is part of which part? Hindgut.
Hindgut.
And hindgut is supplied by which vessel?
Inferior
Inferior mesenteric artery.
mesenteric.
And inferior mesenteric artery originates from the lumbar 3 level. That means আপনাকে বলা হচ্ছে একটা ডাইভার্টিকুলেট করা হয়েছে, ডাইভার্টিকুলাইটিস আপনার কাছে আসলো, আপনি একটা রিসেক্ট করলেন এন্ড আপনার সিগময়েড কোলনে, এন্ড সিগময়েড কোলনে ব্লাড সাপ্লাইটা পাচ্ছে আমাদের inferior mesenteric artery থেকে, and inferior mesenteric artery vertebral লেভেলটা হলো নাম্বার 3 লেভেল. Is it clear to everyone right now?
Yes.
Okay, so if is it clear, I'm coming to the celiac another branches. So another branches are not that much important. Just have a look here. You may get medial sacral artery just only from behind one, but one important you will get the renal vessel, bilateral renal vessel, that is the in between number 1 and is the number 2. So from this portion you will get lateral branch, that is the right and left. This is the right and left renal artery. Sorry, right kidney is higher or lower than left one? So this is the renal
Long.
artery. This is the renal artery, right? So number 1 and number 2, and just below this one you will get testicular artery. Just from here you will get right and this is the left testicular artery, and you will get some lumbar vessels from the behind, and these are the paired, and you will get one sacral artery from the behind. This comes just directly like this way, and just immediately coming into the diaphragm there is a very tiny small vessel to supply the diaphragm, and this is called inferior phrenic artery. Inferior phrenic artery. So could you tell me what is the level of the inferior phrenic artery? Level of inferior phrenic artery? Thoracic 12, same value.
Thoracic 12.
Just coming into the abdomen. Give the lateral branch. This is the ventral branch and this is the lateral branch at the same level, thoracic 12, inferior phrenic artery. Okay. And renal artery in between the number 1 and number 2, and definitely right one is lower from the left one because you will have liver here. That's why it is lower than right left one. Okay. So this is the after below the lumbar renal artery you will get the gonadal vessels. So I think we have discussed about the branches. Now come to the celiac trunk first. Okay. Celiac trunk, at first this is the celiac trunk. Now tell me from which level celiac trunk arises? From which level?
Thoracic 12.
Okay, so before that I would like to draw the stomach. Just behind this part. Okay, celiac trunk has main 3 branches. One is called splenic artery. Just behind the stomach is the splenic artery. Another one is called left gastric artery. It goes by this way and arch at this part of the stomach and gives blood supply here. And another part is called hepatic artery, or it is called common hepatic artery. Is it clear? So what are the main branches of the celiac trunk? Someone tell me what are the main branches of the celiac trunk? One is
Left
gastric
gastric artery, splenic artery, and common hepatic.
Common
Okay.
hepatic artery.
Right, come here. This left gastric artery gives few branches from here and to supply the esophagus.
Is it lower in
Or
the
esophagus
esophagus?
has few parts: cervical part, thoracic part, abdominal part. So this is the, as it has already crossed the diaphragm, so it is known as the abdominal part of esophagus, and this part is supplied by the esophageal vessels. So esophageal vessels or esophageal arteries have branches of which of the following vessel? Esophageal artery
Left
branch
gas-
of left gastric artery. Very good. It's a very common
Left
question for MRCS. It's very important. So esophageal artery is a branch of left gastric artery. Okay. Come to the splenic artery. Splenic artery comes here and it just directly enters into the spleen, and it gives few branches here to give supply to the fundus and few branches along this greater curvature. So these vessels are known as short gastric artery. Now tell me, short gastric artery is a branch of which vessel? Short gastric artery is a branch
Splenic
of
artery.
splenic artery, and this vessel is known as which left epiploic or gastro-omental.
Yes,
Left
gastro.
epiploic or gastro-omental artery. Okay. Okay, so these are the branches of left gastric and splenic artery. Now come to the most important part. This is the hepatic artery, common.
Hepatic.
Okay, common hepatic artery. Now common hepatic artery is divided into two parts. This is called or it is called gastroduodenal artery, and another one that is called hepatic artery proper. Okay, this gastroduodenal artery just goes behind the first part of the duodenum. That means we found a very important structure behind the first part of the duodenum that is called gastroduodenal artery. This gastroduodenal artery divides into two parts. One is anterior pancreatoduodenal artery, and another one is called posterior pancreatoduodenal artery. Are you getting me, guys? Because below this portion, below this curve, you will get the pancreas. So gastroduodenal artery has two branches. One is anterior pancreatoduodenal artery, and another one is posterior pancreatoduodenal artery. Okay, from the anterior pancreatoduodenal artery, you will get one branch that supplies this part, and this is called right gastroepiploic artery or gastro-omental artery. So left gastro-omental artery originates from the splenic artery, and right gastro-epiploic or gastro-omental artery branch of which vessel, bhaiya, everyone? Anterior pancreatoduodenal artery. Okay. So I'll coming this portion later on. Before that, I would like to end this portion. Okay, this is the lumbar 1 level, and from the lumbar 1 level, which vessel arises? Ventral branch. Which vessel? Please tell me. Which vessel? Supramesenteric artery. Okay. Supramesenteric artery just comes along the anterior, just overlapping the anterior abdominal wall. Anterior abdominal aorta, and it gives the first branch here, and it goes here and anastomosis this part. So these vessels are known as inferior pancreatoduodenal artery. So it is the inferior pancreatoduodenal artery. So superior, anterior, and posterior pancreatoduodenal artery anastomosize with the inferior pancreatoduodenal artery, and this is the branch of which vessel? And this question came in our previous exam. Which vessel? Inferior pancreatoduodenal artery branch of supramesenteric artery. And supramesenteric artery mainly supplies which part? Midgard, right? So it will give few branches from the jejunal branch, few iliac branch, and this branch is called ileocolic artery. Here this artery forms a terminal artery, and this is called appendicular artery. This is called appendicular artery. Now tell me, appendicular artery branch of which of the following? Appendicular artery branch of?
Terminal branch of ileocolic artery.
Yes, and ileocolic artery is the branch of?
Supramesenteric.
And supramesenteric artery originates from which of the following vertebral level?
Lumbar 1.
Yes, very good. Now it gives few branch. It's called right colic artery to give supply the ascending colon, and it gives few branch. It's called middle colic artery to supply the transverse colon. Okay, are you getting me, guys? Few branch transverse colon.
Okay.
And here it forms a terminal vessel that anastomosize. Before that, I am coming into the inframesenteric artery. Is the inframesenteric artery? This inframesenteric artery supplies the which part of the gut? Inframesenteric artery supplies the which part of the gut? Hindgut, right? So at first it will give you left colic artery. It will give you sigmoidal artery, sigmoidal vessels, sigmoidal arteries, and it will give you upper rectal. So inframesenteric artery has three main branches. Someone tell me, what are the three main branches? One is left colic. Sultan bhai, are you here? Sultan bhai, are you here? Are you attending the class? I don't know. Just have a look who are attending in the classes. So Shondeep bhaiya, are you here? Ruhul, are you here, Bhaiya? Dr. Ariful, everyone, are you here? Just some
Yes.
sometime please unmute yourself and just to interact. Dr. Sultan Bhai, please continue. So inferior mesenteric artery has three branches. One is left colic artery, one is sigmoid vessels, and one is superior rectal
Superior
artery.
rectal.
Right. Okay. This vessel, this left colic artery forms a anastomosis with this terminal branch of medial colic artery, and this vessel is known as, someone tell me, marginal
Artery.
marginal artery of Drummond's. So sometimes have a look, if there is any occlusion of the inferior mesenteric artery, this vessel will give you collateral circulation, and this vessel comes from the medial colic artery, from the superior mesenteric artery. Is it clear? So you'll be asked in your exam, which of the following structure or vessel anastomosis or forms the connection between the superior mesenteric artery and the inferior mesenteric artery, and that is nothing but the which vessel? Marginal artery of the
Marginal vessel.
Drummond's. Marginal artery of the Drummond's. Right. So I think we have covered the superior mesenteric artery and inferior mesenteric artery, and we'll come those things later on. Right. Now come to the ciliary trunk again. So we have discussed about this thing. We have discussed about it. Okay. So this is the left colic artery. This is the left gastric artery, and here there is another vessel that is called right gastric artery. Right gastric artery has few different origins. It may directly comes from this structure, or sometimes this show anatomical variation. Sometimes it comes this hepatic artery proper. So it might come from this structure, and this structure is known as common hepatic artery. Common hepatic artery is divided into two parts, gastroduodenal artery, and this is called hepatic artery proper. So left gastric artery or right gastric artery, sorry, comes from either common hepatic artery or hepatic artery proper. Are you clear? This shows very common anatomical variations. Okay, so we are looking just it coming from this portion. Okay, now come to the hepatic artery proper. Hepatic artery proper divides into two parts. One is right and left hepatic artery, and assume this is nothing but the liver. This is the liver. So here it divides into, and this liver is very low lying. I'm showing a very tiny liver. I'm very bad in drawing the pictures. Okay, so this is the hepatic artery, and this is the hepatic artery. So this one is the right hepatic artery, and this one is the left hepatic artery. Is it clear, guys, up to this portion? Please let me know. I'm going to discuss a very important question.
Yes.
Yes. So ultimately, right hepatic artery goes into the right lobe, and left hepatic artery goes in the left lobe through the porta hepatis. Before that, right hepatic artery gives a branch, and this supplies the gallbladder, and this is called cystic artery. Now tell me, cystic artery is the branch of which of the following vessel? Someone tell me.
Right hepatic.
Right hepatic artery. Very good. Now they'll ask you, you have done the cholecystectomy, what you are performing the cholecystectomy while you are dissecting the callous triangle, you identified the cystic artery, and cystic artery is a branch of which of the following? Right hepatic, left hepatic, hepatic artery proper, or common hepatic artery, or gastroduodenal artery? Which vessel? That is the right hepatic artery. Very, very important question. You'll get this question in a very regular basis. Okay. Now come to this portion. I have told you this is the gastroduodenal artery, and this is the first part of the duodenum. So this vessel just goes behind the first part of the duodenum, and it's a very common peptic ulcer disease. Very commonly affects the anterior wall because it is a hypovascular. because posterior wall is very vascular because gastroduodenal artery goes behind the posterior duodenum. That's why it's a very common when there is any peptic ulcer disease or perforation occurs mostly the anterior wall of the duodenum. This is the reason. So while a patient develop duodenal perforation and if occurs in the anterior wall of the duodenum, patient develops pneumoperitoneum. Pneumoperitoneum. And if the posterior wall is involved, perforation occurs, it involves the which of the following vessel, bhaiya? Which vessel? That is the gastroduodenal artery.
Yes.
বুঝা গেছে? তার মানে আমরা বলছি যে ডিউডেনামে আলসারটা মেইনলি অ্যান্টেরিয়র ওয়ালে হয়, কারণ এখানে ব্লাড সাপ্লাইটা কম পোস্টেরিয়র ওয়ালের তুলনায়। যদি অ্যান্টেরিয়র ওয়ালে পারফোরেশন হয় দেন পেশেন্ট উইল ডেভেলপ নিউমোপেরিটোনিয়াম। যদি পোস্টেরিয়র ওয়ালে হয়, ইটস এ ভেরি difficult situation and dangerous situation because it is a larger blood vessel. Erosion of this blood vessel very commonly happen, and that is called, this vessel is called gastroduodenal artery. This is called gastroduodenal artery, and this vessel will eroded out and it will develop huge hematomesis and melena, and there is huge bleeding of this patient. That's why আপনাকে অনেক সময় কোশ্চেন করবে, if there is a perforation occurs in the posterior wall of the duodenum, which of the following vessel mostly injured or involved here? Which vessel? That is the
Posterior
gastro.
duodenum.
There's no posterior duodenum. That is called gastroduodenal artery, and this is the branch of this common hepatic artery. This is called gastroduodenal artery. Gastroduodenal artery. I think we have covered the most important part. Let's come into the. So if you want to have a screenshot, you may have a screenshot of this ugly picture, but come to the book. Okay. This is called anterior abdominal wall. We have discussed every single thing. So is the thoracic 12 level, is the lumbar 4 level divided and left to the midline. And these the branches we have already discussed. So this is the 3D picture, and I have collected this picture from the Gray's anatomy. So this is the celiac trunk, this is the supramesenteric artery, just behind this portion is the inframesenteric artery. And this is the left colic artery, this is the medial colic artery, and medial colic artery and left colic artery anastomosis with the which vessel, bhaiya? Which vessel? This is called marginal artery or Drummond's. Marginal artery or Drummond's, right? And it has 3 branches. One is left colic artery, one is sigmoid, one is suprarectal artery, and this is the terminal branch. And this is the, now tell me, inferior pancreatic artery arises from which of the following vessel? Inferior pancreatic artery arises from superior mesenteric artery, and this is the first branch. The first branch, inferior pancreatic artery. Right. Then you'll get the right colic artery. This is the right colic artery. This is the which vessel? Ileocolic artery. Is the ileocolic artery. And ileocolic artery gives the origins from the appendicular artery, and it supplies the appendix. Yes, these are all of the most important part of the anterior abdominal one. I think it's clear to you guys. Please let me know if you are clear.
About that, there's a branch from the common hepatic artery.
Yes.
Is there any branch the name of superior pancreatic duodenal artery?
Yes, this is the superior pancreatic duodenal artery. Yeah, we already mentioned those things. Is the inferior pancreatic duodenal artery, and this is the superior pancreatic duodenal artery. And this portion is gastroduodenal artery. Gastroduodenal artery forms the superior, anterior, and posterior superior pancreatic duodenal artery. And this anastomosis with the inferior pancreatic duodenal artery. And this anterior superior pancreatic duodenal artery gives origins to this right gastrocolic artery. Or sorry, not the gastroepiploic artery, right gastro-omental or gastroepiploic artery. And this is the gastrocolic artery. And I have already mentioned that gastrocolic artery goes behind the duodenum, first part of the duodenum. So if there is any erosion of this vessel, mostly the vessel involved is the gastroduodenal artery. Is it clear, bhaiya?
Yes.
Yes, clear.
Yes. Now come here. I have told you already. This is the left colic artery. Left colic artery gives a branch that is called esophageal vessel. It's a very important part. and abdominal part of the esophagus supplied by this esophageal artery, and esophageal artery supplied from the left
Left gastric.
gastric artery, right? And this is the hepatic common hepatic artery. It's a gastroduodenal artery, and this is the hepatic artery proper. So you'll have the right gastric artery. Right gastric artery may originate from this vessel or originates from this vessel. Those things, because this thing very commonly shows anatomical variation. That could come from the common hepatic artery. That could also come from the hepatic artery proper. Here it is shown came from the hepatic artery proper. Whatever, and is the hepatic artery proper. Hepatic artery gives two branches. One is right hepatic artery, and another one is left hepatic artery. It gives the
Left hepatic
supplies the liver, and right hepatic artery supplies gives originates a small vessel that is called cystic artery. It's very important.
cystic artery.
So cystic artery arises from which vessel? That is called right hepatic artery. Okay, guys, is it clear to you? Please let me know. Is it clear to you?
Yes, ma'am.
Okay, so come to another portion that is called aneurysm. Though I will show